Welcome to GuideMia. Today we're going to talk about how a dental assistant prepares a case on Cympha. If you're the DA in a practice that runs on Cympha, your job before a routine new visit is simple to state. Land everything the doctor needs before the doctor walks in: the case, the photos, the scans, and the notes. This lecture is that sequence, in the order you'd actually run it. Create the clinical case, capture chairside photos by phone, pull in scans and radiographs, type the initial notes, and hand off. By the end, you'll have a repeatable routine you can run in the minutes between seating the patient and the doctor arriving. Follow along at your chairside computer, or listen now and read the written guide later. Step 1. On the Cympha dashboard, click New Clinical Case. The form asks for the basics: patient name and date of birth, contact information, and pay attention to the email address, because that's what the doctor will use later if they share a treatment plan with this patient. The phone number is optional. If your practice cross-references another practice management system, enter the PMSID so the two systems can be matched up. And the chief concern, in the patient's own words, pull it from the booking notes or from what they said at reception. Click Submit. The case is created with a clinical status. That's the resting state for doctor-managed clinical cases, and from this moment, everything you upload lands on this case automatically. Here's the new case form. It looks like any intake form, but what it changes is everything that used to happen after intake. In the old routine, patient demographics get typed here, then retyped into the practice management system, then typed a third time onto a lab slip when the doctor orders work. On Cympha, this form is the one place patient data lives. The consultation the doctor runs, the plan they share with the patient, the lab case they branch later, all of it inherits what you're entering right now, which is also why it's worth getting the email address right the first time. Step 2. Photos. The fastest way to capture intraoral and extraoral photos is upload by phone. The button sits on the File section of the new case page. Click it, and the desktop shows a QR code. Scan that code with the practice phone, and the phone becomes a camera feeding this exact case. Take your photos, hit send, and they land straight in the case file list. No cables, no emailing yourself pictures, no importing from a camera roll. When you're done, close the phone page. 2 habits make this smooth, straight from the written guide. Use the same phone every time so the routine is muscle memory, and if the doctor asks for more shots mid-exam later, you just run upload by phone again, and the extras land in the same case. Shoot in your usual sequence, and if the practice doesn't have a usual sequence yet, adopt this one. The smile, relaxed, and then posed. The frontal retracted view, lateral right and lateral left, retracted. The upper occlusal, then the lower occlusal. And finally, any specific tooth close-ups the doctor asked for when the visit was booked. The written guide's advice here is worth repeating. Standardize the sequence across the whole team. Train everyone on the same shot order, because when every case's photos arrive in the same order, the doctor reviews them without hunting. Their eye knows where the lateral is every single time. Consistency is what turns a pile of photos into a record. Step 3. The scanner output and the radiographs. If the chairside computer has the Cympha agent installed, this step nearly runs itself. The agent's file monitoring watches the export folder of your scanner, your Pano, or your CBCT, and when a new file appears there, it shows up in the agent's panel, ready to send to Cympha with a single click. If there's no agent on this machine, the fallback is simple. Drag the files from the export folder and drop them into the case drop zone in the browser. Either way, the formats you'd expect all work: STL, PLY, OBJ, DICOM, JPEG, PNG, zip archives, and GVW files. And one small liberation from the guide: don't worry about file naming. Cympha keeps the storage tidy internally. The name you give a file is simply the name you'll see. Step 4. Notes. Add what you learned while getting the patient settled. The medical history they mentioned at intake, medications, allergies, smoking, recent dental work elsewhere, any pain triggers or discomfort they reported when they sat down, and anything the patient explicitly asked you to flag for the doctor. Those "they'd never say it to the doctor" comments are often the most useful thing in the chart. Don't polish this. It's a scratch pad, and it's meant to be one. The doctor will refine your notes into a structured consultation during the exam. Your job is capture, not composition. Get it down while it's fresh, in whatever words come. Step 5. The handoff. When the photos and scans are in, and the chart is annotated, message or notify the doctor that the chair is ready. They open the case at their desk, see everything you've landed, and walk in already oriented. That's the whole point of the prep. And your role doesn't end at the door. During the exam, you keep working alongside, hand instruments, and when the doctor requests additional photos, run upload by phone again. The extras land in the same case in real time. If the doctor dictates into clinical notes, you can scribe, typing while they speak, so the findings are captured in the moment instead of reconstructed afterwards. After the appointment, if the doctor shares a plan, the patient gets an email link and can read and approve from the parking lot or at home. Nothing further is needed from you, unless the doctor flags a follow-up. It's worth naming what this routine actually eliminates, because each item is a real-time cost in most practices. No retyping patient demographics from the scanner export into the practice management system onto a lab form. Cympha is the one place patient data lives, so it's entered once. No emailing photos to the doctor, because they're already in the case the doctor is about to open. And no where's that text ray from Tuesday conversations. Every file is on the case, searchable by patient and by date. Multiply those minutes across every visit in a day, and the prep sequence you just learned is one of the highest leverage habits in the practice. So that's the routine. Create the clinical case, shoot the photo sequence by phone, land the scans through the agent or the drop zone, type the scratchpad notes, and hand off. 5 steps, same order every visit, and the same phone every time, because the routine is the point. Nothing in this sequence is hard. What makes it valuable is that it happens completely before the doctor arrives on every single case. Once it's muscle memory, the doctor never walks into a chair that isn't ready, and the case you prepped this morning is the same case the consultation, the patient share, and the lab order will all build on later. That's a lot of leverage for a few minutes of prep. The step-by-step written version lives at cympha.com. Open Docs and find how a dental assistant prepares a case, with the photo sequence and the tips laid out to share with your team. We're walking through every Cympha workflow in this series, one lecture at a time. Subscribe to catch the rest. Thanks for watching, and see you in the next one.